Welcome and thank you again for joining us for MESA Week. Today is our first day of the event, and the theme for today is, appropriately enough, healthcare. This session is called College Hangouts, and we're so happy that you've been able to join us. My name's Josh, and I'll be the MESA host for all of today's activities. We'll start this session with a brief introduction from our speakers, follow up with a Q&A, including questions from our moderator and from the audience. For those of you who joined us for our last session, Career Insights, some of these guidelines may be a reminder, so please bear with us. Those of you who are new to Big Marker, you'll notice that we've turned off the video features to protect your privacy. However, you can send us questions through the Q&A tab on the right-hand side of the screen. We definitely encourage you to send those questions in. Please keep in mind we've got a lot of folks and might not be able to get to every question, so make sure to upvote your favorite question. Those will make it more likely that those get answered. Please be mindful of our privacy policy on our homepage and don't post anything inappropriate or you'll be removed from the session. Throughout the session, please post your questions in that Q&A tab and we will ask them at the end. Tag us in photos and videos using our handle @OregonMesa or on Facebook. At the end of the week, we'll share our favorite photos and videos during our awards ceremony. Tune in at 3 p.m. on Thursday for that. Seniors, make sure that you join us at 2 on Thursday for a special graduation ceremony. We're so proud to celebrate your accomplishments. Stick around until the end of this presentation and complete a feedback form about your experience, and you'll be entered to win a Smart Circuits Games and Gadgets Electronics Lab. We'll announce the winners of our session on Thursday during our end of week ceremony. And now I'm proud to kick it over to our moderator, Carla. Carla, take it away.
Thank you, Josh. So my name is Carla Barraza. I work for Oregon MESA. I'm the event and volunteer coordinator, and I am joined today by Katie Erickson. She is a third-year medical student at OHSU and soon to be dermatologist. And then thank you so much for joining us. Also, everybody, it is Katya's birthday today, so let's give like a woo woo for the fact that she's here on her birthday. This is super awesome. And before we hop in and before Katya tells us a little bit about herself, I just want to start off with saying that in this session, we are not going to be accepting questions about medical advice or anything in that kind of neighborhood. Katya is a medical student, soon to be doctor, but still a student. And we just kind of want to respect that boundary. Your questions are super valuable, so feel free to put them in the chat and we'll record them. But we're going to try to keep it to just kind of talking about like the medical student experience. So thank you very much. And I'm going to kick it over to Katya.
All right, guys, I'm so excited to be here. Thank you for having me. So I'm a medical student. My name is Katia. I'm in the third year of medical school. And so what I'm going to talk about today is a little bit about who I am, why I wanted to be a doctor, how to become a doctor, what it's like to be a med student, and then answer any questions you guys have. So a little bit about me. I have one more year until I'm officially a doctor, which is both very exciting and very terrifying. I have decided I wanted to be a dermatologist, which is a doctor of the skin, hair, and nails. But other things I like to do, I like to paint, I do lots of artsy stuff. I like to play Nintendo Switch, especially during all of this quarantine. And then I have houseplants you can see behind me, and yeah. So a little bit about my story about how I got to be where I am. So when I was a kid, I had a number of medical problems. I had multiple surgeries. And so I was always a little bit interested in the field because I had that exposure to it. But I really hated being poked with needles, and I couldn't watch anyone be poked with needles. And so I thought I was super squeamish and that I couldn't go into medicine. So it turns out that doesn't mean you're squeamish. Nobody likes being poked with needles. And that doesn't mean, even if you are squeamish, it doesn't mean that you can't be a doctor. So my last year of high school, I got to watch a live surgery. It was something that one of my teachers arranged for us. And I was sitting there ready to feel like I needed to throw up or pass out or something. But then it happened and I didn't feel squeamish at all. In fact, I was completely just awestruck with how amazing it was. And from that point on, I decided that I wanted to be a doctor. Some people decide earlier than that. Some people decide much later than that. So after high school, I went to college and I got a degree in microbiology, which is the study of like bacteria and viruses and the immune system. And then after college, I took 2 years and just worked and didn't go straight into med school. Some people do go straight into med school. Some people take much longer in between college and med school. It's becoming more and more common to take some time in between. During that time, I got married. I then started med school, and one of the things I've done in med school is I started a student art magazine. So the general steps to getting into med school and then becoming a doctor. So after high school, you go to university and you get a bachelor's degree, which is usually 4 years. And you don't have to get your degree, the thing that you take the most classes in something sciencey. I had some friends who took classes in art history, but you do also have to take some prereqs before med school and things like biology, chemistry, and physics. And then the other thing you do in college is you spend some time volunteering and you spend some time in the clinic either through working or through shadowing, which I'll talk more about. Those are good things to do, not only just that you have the experience, but it's also things you'll put on your med school application. So it's good things to make sure that you do. Somewhere in there, either during college or prereqs. Good question. So prereqs is like a pre-requirement. It's a class that you have to take before something else. So in this case, you have to take a certain number of biology credits before you go to med school. So the MCAT is a test that you take either in university or I took it after. But it's basically a standardized test. If you're familiar with the SAT or the ACT, it's kind of like that, but it's more focused on things like biology and chemistry and physics. And some people study for a month, some people study for 3 months. It's a big test, but there's plenty of resources out there to study from. And it's one of the things that goes on your med school application. So after the MCAT, you apply to medical school. Medical school is 4 years long. 1 to 2 years of that time is classroom-based learning, very similar to what you'll experience in college. And then the other half of the time, you're on rotations, which is actually being in the hospital or in the clinic, the doctor's office, in many different specialties, getting experience, but also seeing what you like. During med school, you also have 2 board exams, which is exams that you have to take and pass in order to one day be a doctor. And then after medical school, you go into residency. And as a resident, you are a doctor, but you don't quite practice on your own yet. You act as a doctor, but you have other doctors there who are either residents who have been there longer than you or who have graduated from residency that are there to back you up while you're learning. And then there's a couple more board exams in residency. And one thing that I want to point out is I've talked a lot about the tests involved here, and there are a lot of them. But one thing I want to make sure you guys need to know is if you feel like you aren't the best test taker or it takes you longer to take tests, that doesn't preclude you from going into medicine if it's what you really want. I have classmates who just need a little more time to take tests, and it's an accommodation that they're able to get through the school. So as far as the day-to-day life of a med student, it really depends. The first 1 to 2 years that are the classroom-based stuff in the beginning, it's a little more predictable because it's like lectures and learning clinical exam skills, how to, listen to the heart, listen to the lungs, and taking tests and things like that. Regular school like you're used to. And then the second half are those rotations that are in the hospital or the clinic where you're actually seeing patients and learning new skills and doing hands-on learning. So during that part of school, there are 7 required rotations that are in various different specialties. You guys have probably seen either a family medicine doctor or a pediatrician. Those are 2 of the core rotations that we do. And there's also electives that you can take depending on what you're interested in. So there's stuff like you might have heard about anesthesiology or orthopedic surgery or plastic surgery. And so you can really dive into whatever you're most interested in. I wanted to talk about that picture really quick. So this is a picture of rounds is something you might have heard of. This is a big thing for med students. You might have seen it on TV, but basically there's a big group of doctors and residents and med students, and we walk around the hospital and go to each of our patients' rooms. And as a med student, you'll see these people who have the shorter coats. That's the med students. They have gone and seen their patients beforehand, and they talk to their patients and examine their patients. And then during rounds, they present what they learned about their patient for that day. So that's a big thing that we do, and it's a skill that we get. Okay, so the good parts of med school. One of the first things that I noticed about med school that was great was that I was actually learning what I was most interested in and learning new skills that I could actually use. You might be like me, where you have some subjects you really love learning about, and then maybe some that you're not so much of a fan of. So I, for example, never really was a big fan of history. And it's great because in med school, I don't really have to learn about history. I get to learn about the human body and how that works, which is wild. I also get to learn how to tell if someone's ACL is injured, or if someone has strep throat and should see a doctor versus if they just have something viral and should stay home, which is really cool skills to have. So the other cool thing in med school is you get to do procedures, which is a lot of hands-on stuff. So I actually get to help do surgery sometimes. I get to, you can put in IVs, which is like the needle they put in the arm of patients who are in the hospital. I can give vaccines. I can do procedures like that, which are fun. The best part of being in med school is the reason why anybody becomes a doctor, and that's because they want to help people. So many times when people are coming to the doctor or in the hospital, they are not having a good day. In fact, they're often having some of the worst days of their life. And so as the doctor or the med student, you get to help them feel better, which is one amazing thing. But also while they're there and you're the med student, you have the most time out of anyone to sit and talk to them. And that's something that I love doing. I have spent hours just sitting and talking to a patient who was in the hospital because they were kind of scared or lonely. And it's one of the most rewarding things I've done. Basically, everyone who goes to med school does it because they want to help people. It's kind of a cliche, but it's true. The other good part about med school, it can be very busy, but most of the time you still have time for your other hobbies and things that you like to do. Some other cool parts of med school. So I have done some research in med school, and I've gotten to travel and present my research. So this first picture, I got to go and present some research in Washington, D.C., and travel around the area a little bit while I was there. And then I actually also got to go to Italy and see Venice and Rome and present my research there. So the hard parts of med school, these are things you probably have learned about. Pretty much everything that's hard about med school boils down to the fact that it can be really busy. So you can be stressed out because you have lots of things to do. For example, on my surgery rotation, I was getting to the hospital at 5 a.m. and leaving at 9:30 p.m. and I still had reading and homework and things to do. And so that can be really stressful because you actually just don't have enough time to do everything. And so you have to be able to prioritize what's most important. To go along with that, sometimes you don't have time for those other things that you really like to do, like your hobbies and seeing your friends or sleeping enough. You study quite a lot. I have a picture here on the far left. This is a picture of me studying for my first board exam. And this is actually me in the emergency room. And I have an IV in my arm, but I still really needed to study. So that's definitely one part that can be kind of a drag. And then the other part is something called imposter syndrome, which you might have heard of before. Imposter syndrome is something that you might be experiencing now, and it's a very common thing to experience, especially as you start getting more and more into your careers. And imposter syndrome is basically something where you feel like you're the only person who doesn't deserve to be somewhere, or that you don't know enough and everyone else knows what they're doing. And it's a lie that we tell ourselves. But even though I know it's a lie, it's something I still experience and can be hard. And like I said, this is something that many people experience even in high school and middle school. So, but the thing about these hard parts of med school is it's not all the time. And as you go through them, you learn how to deal with them, you learn how to have effective time management, and you gain a lot of skills out of them. But also they don't last forever, which is nice. So some general advice I have for anyone who's aspiring to go into medicine of any kind, whether it's a doctor or a nurse or a physician's assistant, is to do shadowing. And what shadowing is basically following a doctor around, or a nurse, or a physical therapist, or whatever, and just seeing what they do on a day-to-day basis. This is something you can do in high school. And good ways to find, we can talk more about it, but good ways to find someone to shadow are, you can ask your doctor if you have a family friend who's a doctor. But if you don't have any of those connections, you can just call the hospital and express their interest, express your interest. And a lot of times they have pathways set up for you to start shadowing. And while you're shadowing, you can ask them questions. And sometimes if you get a good connection with a doctor, they can actually mentor you, which is kind of help you along the rest of your process long term. Another good thing to do if you want to go into medicine is to practice your study skills. You may or may not in high school feel like you need to study a whole lot. Even if you don't feel like you have to study a whole lot, I really recommend practicing your study skills, finding what way you learn the best. For example, I'm an auditory learner, so I learn best by listening, which is hard when you read a lot of textbooks. And so what I've learned to do is to try and find videos of people teaching this stuff so that I can learn it better. Also learn to self-motivate and organize yourself, because that's definitely something you'll have to do. And then the last thing I really recommend is to hold on to what makes you happy on the way. So whether you're going into medicine or something else, you're going to be really busy sometimes. And when you're really busy, sometimes the easiest things for you to forget to do are those things that make you happy. Whether it's your hobbies, seeing your friends, sleeping enough, eating enough. And I really think it's really important for you to keep doing those things, because that's how you stay sustainable. That's how you keep doing all the things that you need to do. And so it's really important not to think, I'll do that someday. I'll get back to that hobby someday. I'll push it off. It's important to keep doing those things now. And that's all the slides I had for you guys. Here's a couple more pictures of things from my career up to this point, but I really want to save a lot of time for your questions. So.
Hey, thank you so much, Katia. That was really amazing. So we're going to jump to the Q&A portion. And again, just to say it again, we're not going to be taking questions about medical advice, but we have lots of really awesome questions. So the first one that I see popping up, so make sure to upvote if you like a question. So the first one we have here is, what are the most important qualifications when applying to med school?
Mm-hmm. So the most important qualifications when going to med school, I'll talk about just what goes into application in general, and I'll talk about maybe they're all kind of important, but they say that they review an application holistically, which means they look at the whole thing. So if you're weak in one area, but you're strong in one area, it kind of can balance out. So the parts that go into your medical school application are things like your grades, your MCAT score are some of the numbers things, but some of the other stuff is if you've done research in college, your volunteer activities, any work you've done that's been, any work at all, but especially if it's something that's interesting or you learned a lot in, making sure you've shadowed enough, because they want to see that you know what you're getting into, because like I said, it can be kind of hard sometimes. So those are the things, and I don't think there's necessarily any one that's most important. Sometimes people will put a lot of emphasis on grades and test scores, but like I said, if you need to balance those out by having a lot of volunteer activities and hours and things, that you can do that.
Awesome. Thank you, Katya. The next one we have here is, what is the difference between being a doctor and a surgeon?
Okay, so surgeons are a kind of doctor. So there's lots of different kinds of doctors. Like there's a pediatrician who is a doctor for kids. There's a family medicine doctor who sees people kind of in a doctor's office for many different things. And then there's surgeons, and there's lots of different kinds of surgeons. So if you're not into surgery, you don't have to be a surgeon, but you still go through the same pathway going to medical school. And then afterwards, you get to pick what you want to be.
Okay, cool. Let's see here. What classes should someone take in high school if they want to go into the medical field?
So the classes you take in high school, since you have to take biology and chemistry and physics classes in college, taking classes related to those things can be good prep for college, especially if you have the chance to take some higher level ones. I know the AP like biology class is something I took, and that helped me out enormously in college. So
Okay. I like it. Let's see here. What are some different medical school options?
Good question. Maybe we can get some clarity on this, but I'll try and answer. There's med schools across the country. And then within medical school, there's allopathic schools, which is like you have an MD at the end of your name. And then there's osteopathic schools, which you have a DO at the end of your name. But both of them are doctors, and both of them can be any kind of doctor. There used to be more of a difference in the past, but they're more similar today. DOs learn some of the stuff that's kind of like chiropractic, along with the rest of the stuff that MDs learn.
Okay. Let's see here. Here's a really good one. How do you pay for medical school?
So pretty much everyone who goes to medical school takes out loans. You don't really have time to have a job in medical school. Some people will tutor, but most of the time you don't have time to have a job. And medical school is kind of expensive, so everyone takes out loans. Most people take out federal loans, but some people take out private loans.
Okay. My curiosity is, are there scholarships for medical school available?
Yeah, and it depends. So there's scholarships that the medical school itself will give out, and that obviously depends on the med school. Like OHSU doesn't really have a whole lot of scholarships they give out, actually, but other schools have quite a lot. And then there's private scholarships, which are just like community organizations that put out scholarships for people of different classifications. Sometimes they focus on someone who wants to go to med school who's from a rural area of Oregon, for example. And there's a really good website I think it's called FastWeb, which has just a bunch of scholarships, and you can kind of filter them for what you want. And I think that even applies for not med school too, for college.
Okay.
So
cool. Let's see, we have a few more minutes. How many hours do you spend at the hospital for those first 2 years when you're in med school?
Okay, so during the classroom part of learning, at OHSU, they have a program where once a week you are actually kind of doing shadowing, but a little more than shadowing. And so once a week, you probably spend, I think it was about 4 hours in the hospital.
Okay. And then at what point during medical school do you have to decide which career do you want to go to? Like, for example, like anesthesiology or dermatology, for example?
Yeah, so I think most people have decided by the beginning of fourth year. I actually switched to thinking I wanted to go into dermatology in March. So you can switch pretty late, but I also had friends who applied to multiple different specialties, so they didn't even decide up until the very end. But it's usually probably a good idea to have figured it out by the end of your third year.
Okay, awesome. Let's see here. Some questions so those are some awesome student questions. Some that I was kind of curious about was, this is all, are we good on time? Hi. Okay, maybe, so I'll hold it then. Thank you very much, Katya. I'll hand it off to Josh.
Thank you so much, Katia. I really appreciated you sharing details about your journey into med school, and I hope that some of our students are inspired and have ideas for how to follow you. Students, thank you very much for joining. We have a couple of notes for you before we end this session. First, please stick around to fill out a survey so we can learn more about your experience. Students who complete a survey will be entered to win a Smart Circuits Games and Gadgets Electronics Lab. And we're going to announce the winners of our session on Thursday during our end of week ceremony. We will be beginning our next session, which is OMSI STEM Spark at 3 p.m., where we'll talk about viruses with our friends at OMSI, which is Oregon's Museum of Science and Industry. We really hope to see you all there. I think we might have time for one or two more questions before we wrap this up. If anybody has any last minute questions for Katya.
Oh, goody. Okay, so some questions that I'm seeing here is, why did you want to become a dermatologist?
Okay, so like I said, I am very artistic, and so I love the idea of being able to actually see a disease and diagnose it with my eyes. But also dermatologists kind of have one of the nicest lifestyles. So whereas some surgeons can be called into the hospital in the middle of the night, dermatologists don't really have that happen. So that's nice.
Okay. And then I think we have a few more minutes. Yeah. So one I see here is, what does your daily life look like now? Are you still taking classes and doing rounds, like especially with everything going on right now?
Yeah, so right now we are not allowed in the hospital. So I'm doing online classes, and it just depends on which classes you're in. I just took a class on ultrasound, so I was watching like lecture videos every day and then taking some quizzes. Some people are actually doing tele rounds, so they're like using Zoom to conference into rounds in the morning, which is interesting.
Cool. Okay, cool. Let's see what else we have here. Remember to upvote, y'all. Okay, here. How long does residency usually last?
So it depends on your specialty. So I think the shortest one is 3 years, and the longest one is 7, I think, for neurosurgery. So somewhere in that range. Yeah, it's a lot of school. But during residency, you do get paid instead of paying to be there, which is nice.
Ooh, okay, that is good.
Yeah.
Okay. Let's see here. What classes should I take in high school if I want to get into the medical, or if I want to go into the medical field?
Yeah, so classes in like biology, chemistry, physics, those will all help you. I don't know if they're necessary. So those will help you.
Okay. Cool. Let's see, we have a few more. Make sure I got, let's see here. Sorry. Can you be in med school without doing a surgery, or is surgery part of the curriculum?
So it is part of the curriculum. I have plenty of classmates who really don't like surgery, and so you don't have to like it to be in there. I think you'll like it more than you think. Like I said, I thought I was really squeamish and thought I really don't want to do surgery. And then up until I decided to be a dermatologist, I thought I really wanted to go into surgery. So
okay.
Yeah, you'll have to help in the surgery though.
So we have about a minute left. I'm going to try to squeeze in one last question.
Yeah, I'll be fast.
Is there, like, what do you have to study for an undergrad? Like, is there like a major that's recommended or anything like that?
Yeah, so you can study whatever you want. You just have to make sure that you're also taking some classes in chemistry and biology and physics. But you can study whatever you want. If you do study something in biology or chemistry and physics, that'll help you, but it's not necessary.
All right, cool, awesome. So let's see here, we have about 50 seconds left, so that might be it for us. Thank you so much for joining us, Katya, and thank you everyone who's watching for all of your amazing questions. There's a little thing that popped up for feedback, so make sure to fill it out. Thank you. And happy birthday, Katya!
Thank you.
Thank you, Katya.
So
Happy birthday, and thank you, Carla. Please remember, folks, that our next session with OMSI starts at 3 p.m. We so look forward to seeing you then.
Bye.
All right, bye, guys.